nutritional status is that the major contributors to self-sufficiency, disease recovery and quality of life. Obesity may result from overfeeding, dietetic errors, or other multiple genetic, metabolic and behavioral abnormalities. It induces both insulin resistance and pancreatic beta cell dysfunction, and thus considered because the cornerstone of type 2 diabetes. Intermittent fasting, within which individuals fast on consecutive or alternate days, has been reported to facilitate weight loss, preventing the progression of type 2 diabetes, and consequently improve cardiovascular risk. Disorders of biological time. Fasting has been employed in religion for hundreds of years. The Daniel fast could be a biblical partial fast that's typically undertaken for 3 weeks, and through Ramadan, 9th month of Muslim calendar, all Muslims across the planet fast during daytime of this month, where this consider in concert of the 5 main pillars of Islam. Such periods of fasting can limit inflammation, attenuates pro-inflammatory cytokines and immune cells, improve circulating glucose and lipid levels, and reduce pressure level. Additionally to it, studies undertaken in animals and humans have suggested that fuel selection is altered and efficiency of metabolism is improved while oxidative stress is reduced. Intermittent fasting in animal models induce some cardiovascular benefits like improving pressure and pulse rate, still circulating cholesterol and triglycerides, and reduce carotid intermedia thickness. Moreover, it improves survival from myocardial ischemia through proangiogenic, anti-apoptotic, and anti-remodeling effects. Intermittent fasting also appears to be cardioprotective, providing experimental animals with resistance to ischemic injury in an exceedingly manner possibly related to increases in levels of the adipokine adiponectin. Adiponectin could be a unique adipokine that appears to own beneficial effects, but has circulating levels that are negatively correlated with body composition. However, intermittent fasting modulates the amount of visceral fat and several other additional adipokines, including leptin, Illinois 6, TNF and IGF-1. Although fasting of Ramadan is obligatory for all Muslims who enjoy the spiritual atmosphere during that month, the Quran exempts people who are ill, traveling, pregnant women, during breastfeeding or women during their menses from fasting. However, many of that cases who cannot fast feel they miss an excellent deal, but people who don't follow the doctor's advice during this regard could also be related to health troubles. Fasting of that cases is also risky, especially with diabetes, because it may increase frequency of hypoglycemia, postprandial hyperglycemia with or without diabetic ketoacidosis, together with dehydration and thrombosis.